the Director of State Legislative. I'm the Director of State Legislative Policy, Equity and Transformation here at CCH. Welcome to the webinar, Resigned to the Process, Barriers to Accessing and Maintaining TANF Among Low-Income Families with Young Children in Illinois. A couple of things before we get started. Again, thank you for joining us so early this morning. We have the option for closed captions, so please, if you're in need of closed captions, there should be a box either at the top or the bottom of your screen with CC in it that'll allow you to see closed captions. Please use the chat as well as the Q&A function to drop in any questions. We will have time at the end to answer as many as we can and to engage in a discussion. You will receive a copy of the executive summary as well as a recorded version of this webinar for everyone who has who registered for the event. We will be coming out with the full report pretty soon, and you'll also receive that once that is ready to go. With that, we're going to start with an icebreaker question. Please throw your answer into the chat and for everyone to see. Just let us know what drove you to participate in the this morning's webinar. How are you connected to either public benefits or TANF? You can answer any or all of those questions. But again, we are so excited to have you all here. We had over 100 folks register for this webinar, so there absolutely is interest. For the folks who aren't able to make it today, we are glad that you're having an opportunity to watch the recorded version of it. So without further ado, we'll go ahead and get us started. So to start us off, our agenda today, we've done introductions. We're going to take a moment of acknowledgement, an overview of the partnership between Heartland Alliance and Chicago Coalition for the Homeless, the research questions, methods, and findings, as well as leave time at the end for discussion. So just to let you all know, all of the folks who had an opportunity to work on this project, like I said, folks from over at Heartland and the Social Impact Research Center, Heartland Alliance Policy and Advocacy Team, as well as the Chicago Coalition for the Homeless and our grassroots leaders. And so I am going to, with that, we're going to take a moment of silence. Over the course of the project, our team lost two researchers who were part of our research advisory board, Ms. Leanna Majors and Ms. Edrika Fulford. Their contributions as researchers and advocates to this project cannot be overstated. This report is dedicated to these two women. We also acknowledge Keith Freeman, who led recruitment efforts for the individual interviews in Cook County, who also passed away during this project. He and them are truly missed every day. Thank you, and we'll go ahead and I'll go ahead and pass it off to my colleague, Suniya, over at Heartland Alliance. If you want to introduce yourself and then get us started.
Thanks, Suniya. Hi, everyone. My name is Suniya Farooqui. I'm Senior Data Analyst with the Impact Team, and I'll be going over, giving a brief overview of the partnership. So this project is rooted within the framework of community engaged research, meaning that we created partnerships of researchers, grassroots leaders with lived experience of TANF system and policy experts to conduct this research. I'll hand it to Maxica.
Good morning, everyone. I am Maxica Williams, and I am a grassroots leader with the Chicago Coalition for the Homeless, as well as I wear many other hats at CCH, and I'm also a part of the Chicago Coalition for the Homeless Board. Now, with this slide, hang on, let me flip my page. We are like everyone to take a moment of silence. We've done that. This project is rooted in the framework of community engagement research, meaning that we created a partnership, researchers, grassroots leaders, and lived experience, as Suniya stated. And as you can see here, we partnered across the whole project, including developing our research questions and methods, creating our interview guides, and also reviewing the TANF casework survey and the administrative data request together. We conducted interviews with customers and recipients. We analyzed all of the data together and we interpreted the data. We did storytelling and we also did reporting and dissemination. And I'll pass it back off to Naya.
I'll take it over from here. So we had three main research questions, and they're larger questions. I want to highlight that we went into this project planning to only focus question 2 on barriers to accessing TANF, but in working with partnership with the RAB, we expanded that question to also include maintaining TANF due to the RAB's experience. As you will see, the barriers to maintaining TANF are crucial findings, and so that is just a tangible of the ways in which partnering. Here you can see the data sources used for this project, which included TANF administrative data from 2008 and qualitative interviews with TANF customers and community partners. We used a explanatory mixed methods model by which the qualitative data informed the IDHS caseworker survey, and the variables that we requested were also provided crucial context to understanding those data as well. The IDHS caseworker survey also contained open-ended responses. Given the COVID-19 pandemic, the data we are presenting is from 2018 and 2019. We include tables on 2020, but that's not the main body of the report. So to create the pool of tangible TANF customers for research question 1, we analyzed IPM data from the same years and applied the TANF eligibility requirements to that population. There were some limitations with that process. We couldn't remove families that had reached their 5-year limit and people who were ineligible due to family ban, restricting the restrictions that were in place at the time. But if you want to learn more exactly about that process, please look to the report. Also, as part of the administrative data, we also received a list of denial and sanction codes used by the IDHS caseworkers. We worked as a full team to group these codes into buckets, including bureaucracy, child support noncompliance, and responsibility and service plan noncompliance. So we could compare each of the codes within racial groups. We analyzed each data source separately, but the qualitative interviews really informed how we thought about and how we interpret what we were seeing in the data. And as you will see when we delve into the findings, that the stories we heard about sanctioning and child support really pushed us to not only ensure we had denial sanction reasons, but to consistently disaggregate denial and sanction reason by race and ethnicity. Here you can see the triangulation of the data and that we engaged in, and the mind mapping and the root cause analysis to pull everything together. There were 7 main findings that came out of our research. To know, we're only showing you a sliver of what we analyzed over the course of the 2 years. We really encourage everyone to look to the report to dig into both the qualitative and quantitative findings in the report. Also, for example, right now we will be only showing, we would only include ethnicity data and geography. We only included ethnicity and geography data in the final report, but here we're really going to be focusing on racial differences that we saw in the data.
Maxica, turning it back over to you for the key finding.
Thank you, Naya. Our first key finding was that less than 2/3 of the estimated eligible families with children under 5 were enrolled in TANF in the year 2018. Throughout the presentation, we included quotes from TANF customers we interviewed, so please take a moment to read each one. So you can see here that 62% and 63% of TANF eligible families with children under 5 were enrolled in TANF in Illinois in 2018. We then dug deeper into both the demographics of TANF uptake and then, of course, that there were reasons why we might be seeing these specific gaps. I'll pass it back to you, Naya.
Thanks, Maxica. So the next key finding that we found is that there's a higher proportion of eligible Black families are enrolled in TANF as compared to other racial groups in the state. And so this finding was a bit surprising to us because we know that there are a lot of challenges that Black families also face when applying for TANF. We also know that some families that were eligible for TANF outside of Cook County were enrolled in TANF then within Cook County. So the team then brainstormed and thought about like what could be the conclusion for why this is happening. And one of the things that came up is maybe this is due to stereotypes among white people about what it means to receive TANF and public benefits overall. And so fewer white people actually apply. It could also be because white families have more wealth to lean on. So even if their income makes them eligible to receive TANF, they have other supports that are easier to access than TANF. Many Black families do not have the same support systems. Suniya?
Thanks, Naya. Our key finding number 3 is that Black families are disproportionately sanctioned as compared to other racial groups in Illinois. Here you can see the difference in families who received a sanction versus those that did not, broken down by racial group. 28% of Black families and 25% of multiracial families have received at least one sanction in 2018 and 2019, as compared to 18% of white families. Later on, we'll talk about some of the reasons why we think this might be. Qualitatively, both in interviews with TANF customers and the IDHS staff members, we heard a consistent thread of radicalized deservedness, which our team thinks may underline this difference in sanctioning. Essentially, that regardless of race of the caseworker, Black low-income families are thought to be less deserving of cash assistance due to ingrained stereotypes like the welfare queen, as Naya already alluded to. And because that many experience more sanctions and less grace when faced with complex, complicated, and punitive TANF system. It may also be, as Naya will speak to in a moment, that the sanction reason, which differs among racial groups, might also influence why families experience more sanctions.
Thank you, Suniya. So the fourth key finding is that Black families were more often sanctioned for child support non-compliance, whereas white families were more often sanctioned for failing to meet the responsibility service plan. And for folks who may be new to the TANF work, in order to receive TANF, the custodial parent is mandated to put the non-custodial parent on child support. When we say bureaucracy, we're talking about things like communication or challenges in talking to caseworkers on the phone or paperwork issues. Here you see that 42% of Black families who had received a sanction for child support non-compliance, whereas only 30% of white families were sanctioned for child support non-compliance. From the interviews, we learned that the child support requirement is also a major barrier for families to apply and also reasons why families are sanctioned. Some interviewees shared that in experience of domestic violence prevent women from wanting to go through child support. And while domestic violence does qualify as what is known as a good cause exemption, so you have a reason for not putting the person on child support, the process can be hard and require legal assistance. Other interviewees shared that the father of their child was not in a position to provide child support, but he was providing other supports like childcare, or sending him through the state process would only serve to harm the family. Even if someone does decide to apply, If they can't complete the child support process, and if they don't have an approved reason, they will be sanctioned and or possibly barred from receiving TANF.
Thanks, Aya. Our key finding number 5 is that current staffing structure at Illinois Department of Human Services and the lack of interagency coordination compounds these TANF barriers by removing the human personal connection. In terms of the staffing structure, Illinois implements a staffing structure called the Worker Resource Allocation and Prioritization Structure, or the WRAP, in which caseworkers are assigned to a different set of tasks that rotates. While this was intended to create more efficiencies, in reality, what it does is remove the case management component from TANF so that customers are left navigating a system without a stable person to support them. This quote explains from the perspective of one caseworker the challenges working across state systems. Our key finding number 6 is that the implementation of TANF should reflect the complex challenges that customers face and that policies and practices should seek to remove the barriers to enrolling and maintaining TANF. We found that the bureaucracy of applying to and especially maintaining TANF was a major barrier to families facing economic hardship. Many of the families we interviewed in Cook County were facing housing instability, and the process of submitting all of the required paperwork in particular was a major barrier. We saw a lot of sanctioning for communication reasons in particular, but also heard in interviews that letters that were received well after deadlines were due or missed calls without the opportunity to call back. We engaged in a mind mapping technique to map out the barriers that we identified across the streams of data that led to sanctions and denials. Here, you can see these barriers represented in a tree. At the root, we show the isms that have not only influenced, but really driven the policy and implementation of TANF. The racist roots of TANF have been written about previously by our friends here at CBPP. These isms lead to a rotten trunk of deservedness. They influence who actually should receive cash assistance, and we think that then lead all of these other barriers listed here. We go into much more detail about the different barriers in the longer report, and we encourage everyone to look for it when it's released. We also wanted to show from the IDHS surveys that show the lack of access to childcare, homelessness, and employment status are most frequently listed as #1 barrier at the TANF customer experience. At the same time, homelessness support, employment support, transportation, and childcare are most frequently listed as the services in which access is a barrier pre and since COVID-19. However, the cash delivery system does not adequately address these barriers. Sorry, I'm hand it off to Maxica.
Our last finding is that in 2018, there was an increase in the TANF cash amount, which did not increase the TANF enrollment in Illinois. In 2018, we won a bill to increase the monthly TANF cash amount for all cash TANF recipients. For example, a family of 3 will receive an increase of the amount of $127 per month. And on the next slide, however, we analyzed that data that we saw that increase did not create a significant change in the number of enrolled families in TANF. If it did, we would expect to see the enrollment dots shown here falling within the gray box. But you can see they are above and below, which suggests there was no effect. Our team brainstormed why that might be. It could be that we were asking the wrong question, that it is not whether the cash amount had an effect on increasing enrollment, but instead on families who were receiving TANF at the time. Was it meaningful? When we asked interviewees who were receiving TANF at that time, they did not really notice a difference in amount, or even if they had known that the change had happened with the increase. This made us think that while increasing amount is good for families living in poverty, the amount was still too small to make a big difference in their lives. Next slide. And based on the findings from this research, Here are our state level recommendations. The first is to more meaningfully increase the TANF cash amount for all the TANF recipients. The second is to create a people-centered model of cash assistance in the full report, which you can read about how we envision this system through a TANF superhero we created named Simone. Now, Simone is more of a liaison for any TANF customer who's applying for TANF or on TANF to help guide them through the processes so that they don't have any issues and they feel like they have somebody on their side that understands and knows them, to give them the resources and the different directions they need to go in. Lastly, we do not think that families should be forced to go through child support to receive TANF, as Kim will talk about later. That requires a federal change. So in the meantime, we think that the state should follow the lead of states like Colorado so that at least families who do go through the child support system receive the full amount of child support rather than the state taking some of this to offset the TANF program. And I'll pass it back off to Naya.
Thanks, Maxica. So in hearing Maxica share what our vision around the state, we also know that TANF is a federal program that the state is administering. And thinking about not only we have to do this in a two-pronged way, we have to do advocacy at the state level, but we also have to do advocacy at the federal level. So firstly, we focused our state recommendations on the flexibility that states have within the program. Many of our recommendations do envision significant changes to happen at the federal level. One might say burn it down, but this is a report, we won't say that. Our overreaching recommendation is to move away from highly restrictive, punitive cash assistance systems and towards a system intended to really help families thrive. The aim of an alternative cash assistance system, such as a guaranteed income, would be economic security, not the other values-based outcomes included within TANF of this arbitrary data of 60 months and then you're kicked off of the program. We know that when parents receive cash without the added bureaucracy, oops, sorry, I'm like getting messages and it just did something to my slides. 1 second. Sorry about that, folks. Okay. All right, I am back. And just thinking about all of the bureaucracy that is attached to TANF, the requirements that the punitive sanctions associated with the program do not lean into someone being able to successfully graduate from the program. So we point to the guaranteed income as an alternative. We know that a federal guaranteed income is not going to happen overnight. So in the absence of such a change, the following recommendations would make incremental changes to TANF to better support families. So this first bullet point of restructure the TANF grant so that cash assistance is prioritized and sustained its value. We know that the TANF block grant that each state has received since 1996, that has not gone up. That has not gone up at all. States are still receiving the same amount that they were receiving in 1996. Here in 2022, we have a thing called inflation, and your spending power with the amount that families are receiving has gone down each year. So even as we're thinking about small incremental increases to the cash grant amount, we're still seeing people struggling because everything else in society continues to go up. So this is shorthand recommendation to establish a federal minimum benefit amount and require states to establish a policy standard that intentionally uses TANF-related dollars to expand, increase, and uptake rates and index TANF funding to inflation to ensure the program is more responsive to economic downturn. Then some other recommendations that we have are to remove the child support requirements and allow families to make the decision on how to manage their families. People who are experiencing poverty know what still should have the right to be able to say, this is how my family is going to run, and this is and what systems are best for them. We also say stop sanctioning families, particularly because we know that sanctions disproportionately impacts Black families, and remove the arbitrary 60-month limit, and understand lives, especially those of poor families, aren't neatly wrapped up in able to graduate from the program within 60 months. So and saying all of the things that we've talked about today, what are some things that we should be doing as members of the community? So as I stated at the top, I'm our Director of State Legislative Policy, and I work alongside Kim Drew from Heartland down in Springfield. And we have been working, each year we've introduced legislation that we are hopeful will change the TANF system here in the state of Illinois. Currently, we have a bill, HB 4423, which would, one, increase the TANF grant amount to 50% of the federal poverty level. So we would take it from 30% to 50%. Maxica discussed the idea of the cash grant amount being getting a significant boost so that people are able to meet their basic needs. The second part of the legislation would ensure that child support is actually going to support the child. I just want to repeat that. That seems like such an intrinsic thing that people should understand. But currently, because of how the federal government has set up the TANF program back in 1996, states are permitted to keep most of the money that is collected in child support as recoupment. And then in the state of Illinois, families can receive the first $100 or $200 of the child support. One thing that we've learned is that when child support is late, so if the non-custodial parent pays it late, it is no longer considered child support, and the state is able to keep the bulk of that once it is paid. Our simple solution to that is make sure that the money that is being paid in child support actually goes to support the child. If you're mandating that a custodial parent put the non-custodial parent on child support. And so in the next upcoming weeks, Illinois will be going into, the General Assembly will be going back into veto session. And the bill is HB 4423 is currently in the Senate. And what we're hopeful, it has made it through the House unanimously with bipartisan support. Our hope is that when it that during veto session or possibly lame duck session that happens in January, that the Senate will take this bill up and pass it and send it over to the governor's desk for signature so that we can strengthen the program here in Illinois. And after saying all of that, I want to stop and say we want to take questions and give time for discussion. I'm going to stop sharing my screen and so that I can look at the chat to see. It looks like we have a lot of questions in the chat. So 1 second. Share. All right, and let me go on over. Yes, okay. So one of the first questions that was asked, and thank you so much for asking this, could you define what sanction means in terms of this report? So, excuse me, a sanction happens in terms of TANF when a family or when the parent has not met one of the obligations required in order to stay in the TANF program. That could be child support enforcement. That could be one of the things that we've heard from people is that you're required, in just a quick overview of the TANF program for folks who may be newer. In order to be on TANF, you have to live in poverty. So you have to be below the poverty level. You have to have children. You have to work. You have to put the non-custodial parent on child support, and you're only to be in the program for 60 months. You also have to make sure you're turning in paperwork, making sure that you're making appointments at your DHS office. And if child support enforcement means naming the other parent as well as attending any and all court dates that are set to collect child support. We've heard stories from folks who said, you know, I was required to work in order to maintain my TANF, but I also had to be at court. And both of those things were on the same day. Every time I went to court, the other parent didn't show up for the order. And so the case would be continued. Finally, I just went to work and didn't show up to court. And I was sanctioned because I didn't show up to court because I was meeting the other obligation that I had in order to maintain TANF. So the sanctions, a couple of years ago, we passed legislation to say we should not be doing full family sanctions because sometimes DHS loses paperwork. Sometimes there's, you know, discrepancies like I had to work and you all asked me to come to court and I can't be in two places at once. And so the legislation that we passed pre-COVID stated that there couldn't be a full family sanction, that 75% of this grant actually belongs to the child and should not be touched. And 25% of it can belong to the parent. And within that, you can sanction about 30% of that so that families are not left without any income coming into the household. Next question is, let's see. I feel obligated to share with families considering TANF the push-pull of the child support obligation to determine if the benefit could actually improve their financial situation. But I always encourage caretaker relatives and parents on SSI to get a child-only TANF case, which, and I'll just quickly say, child-only is just, it's that you, the parent will not be a part of the TANF. They will only receive 75% of the grant amount. Because so few of the restrictions apply that they don't have to meet the work requirements. There's not the 60-month, you know, date looming over them. Did you all hear anything from community about those two scenarios for families? I feel as though the particular and unique value of TANF as it is now for those families is relatively less well known. So the question is, in the research, Suniya or Maxica, did you all hear anything from community about those scenarios for child-only grants? Was that, yeah, did you all hear anything or were they part of your interview process?
No, I don't recall any cases that were child-only. I just remember that they were all just the actual TANF with the mother and the child on the benefit.
Mm-hmm. Yeah, I think so. I don't remember that scenario coming up in any of the qualitative data.
Yeah, and it may have been because of how the study was structured. And also people don't know that they could do a child-only grant. Okay, fantastic information and analysis. Thank you. Did your focus group with IDHS staff provide insights to how these workers feel about the effectiveness of their role? And this is coming from David Roth from DuPage.
I don't think we asked them about effectiveness. We did ask them what they need to get their work done. So like what they were missing, what knowledge gaps or what kind of technical training. We asked them about that specifically, not so much about the effectiveness of their role.
All right, thank you. And so I'm gonna go over to the chat to see if we have any additional questions. Yes, thank you, Doug, for saying that it should not be revenue. We went really quickly, but we have 25 minutes left. Are there any other questions? Any other thoughts that folks would like to share as we are working, as we have the time? All right. Okay, Kim, was this a question that came through the chat that you just sent me? If you want to unmute, you can absolutely do that. All right. Oh, okay. What about families that are here due to as refugees or asylum? They can apply for TANF without having a job, right? Kim, did you want to answer that question?
I was just going to say the answer to that question is yes, but I was wondering if Suniya or Maxica wanted to talk about the qualitative interview that was done, where we sort of unpacked some of the unique challenges that asylee and refugees face when accessing TANF.
Yes, we had one applicant for TANF. He had significant barriers with the language and being that he didn't have an interpreter, and the fact that he came here and he wanted to work, but he wasn't able to work because he had a sickly child and his wife had some issues. And he went from his country, he had a very high ranking education, and he came here and he had to just take a factory job. And then he got laid off from that job. He applied for TANF and he had so many issues and barriers with the language. He didn't get any support. He didn't have any help, even from the refugee case manager. He didn't have the help he needed to go through the system and process it. And by the time he did get the benefits, they cut one of the children off. It really did. The DHS office didn't definitively give him a reasoning of why they cut his other child off. And he was always going through the loopholes, and he couldn't navigate the system the way he needed. And that's another reason we created Super Simone, because we know that there's a liaison or someone needs to be, or a position set in place to help individuals so there aren't issues, and that people could get all of the information and resources and guidance that they can get for the TANF process, because it's so strategic to go through the TANF project. The TANF process, the application, getting approved and navigating and working with the caseworkers, because you don't get that one-on-one case management effect. Did you have anything else to add, Suniya?
No, I think that was it. I think his major challenge was the language barrier.
Yeah. And to Maxica's point, I think in reading through the report and reading through the quotes, I'm very excited for everyone to see this. The quotes are just a gut punch, but people feeling like they need to have like a degree in order to like even understand the system. Like you needed to know someone, you needed to have an in order to work through the system, was a lot of what I was reading in the report, is that people just did not feel like if you were just cold calling it, you often didn't succeed. And so Latanya asks, can you go into the requirements for applying for TANF? Can a grandmother apply for grandchildren, and can foster parents apply for their foster children? Yeah, so Latanya, those are often what are the child only grants. And so they won't take into account, and Kim, please correct me if I'm wrong, or if someone else on the in the audience who knows public benefits more than me, they will take into account that the child is being raised by their grandparent or by a foster parent, and not necessarily calculate the income of the person that they're staying with, but solely look at like this child and the needs of that child and provide a child only grant. Okay. Kim, if you sounds like you're going to be coming off mute, or based on this chat that I'm trying to stay.
No, I think that's Suniya.
Mm-hmm. Yep. Okay, so we have a question about the RAB, like how IDHS workers, caseworkers are assigned tasks. So what they do is they come in each morning, they have different tasks that are grouped into different categories. And there's a full table, there's an example of the table in the report. But what they do is they have certain amount, they get tasks that they have to check off. And it might be people that they don't know, they have to refer back to the case note and see like, okay, I have to schedule a call with them. So that's what I have to do today. And then that's what the caseworker does. And they just check it off. And once that's checked off, like they called and then they write down the notes about what happened. Were they able to make contact? Did they miss the client? Like what happens? And that's checked off. Then this caseworker missed the contact, missed the opportunity to chat with them. The next caseworker will get a task the next day to reach out again or try to do some kind of make another contact, and they'll get that task and then they'll complete that task and write their case notes. So they're not the tasks are not related to the individual clients that they know about, they have to refer back to the case notes to see what the task is and then check it off. I hope that kind of explains a bit more about the RAB.
Yes, thank you, Suniya. So I saw more questions come into the Q&A. I know that Kim is typing out some answers, but I will do some answering. So sanctions. So with sanctions, does that mean a family can lose their TANF if they also aren't getting the child support they're owed? Does that mean? Yes. The family can. One thing that each day we learn more and more about the system. The system is really tangled up. So if they're losing their TANF, we are not sure if they're actually even receiving the child support that's being paid into child support enforcement at that point. And so the way that our system works is that our child support enforcement agency lives within the Health Care and Family Services, known as HFS. And so we're not always sure that DHS is talking to HFS. And so if they sanction a family, are they then making sure that in sanctioning them for another reason? So you may not have turned in paperwork at the right time, and it may not have been the child support enforcement piece. You may not also, like, even if that non-custodial parent is paying child support, not even sure if they're receiving the child support as well. And so it's a lose-lose system for families. Does this mean that workers aren't able to develop expertise in any area? Any idea how they are rotated? I think Suniya just answered that question, but I don't know if you wanted to expound on that anymore.
If you're talking about like expertise, like as in like the RSP plan, like they're connected to employment, services and stuff, that actually really is, that's what they're not able to develop. So like usually we heard like, or example that was like the caseworker that's been there the longest has all the resources, has all the knowledge because they already know what is available in the community. So if a new caseworker comes on and they have a client that needs that connection, they don't have that because they haven't built that expertise yet. They don't know. They will have to go to that caseworker that has the most information and ask them for that knowledge. So, and they might not be working on it the next day. So that doesn't really give you time to get familiar with all the resources in the community. So it depends on the task, like contact, you don't need to develop expertise in, but like making those kind of connections to get their RSP completed, you kind of need more knowledge about that, about what's in the community and what's available.
Caroline threw something into the chat that would love to do a discussion on. I really struggle with the potential to make the critical federal changes in the program with the ongoing strong resistance in this country to cash welfare, which is unequivocally informed by white supremacy. Absolutely, Caroline. Have you all thought about how we frame the value of economic security programs in the current political moment to make federal change? I feel really stuck on this point. Kim, do you want to answer? Because if I answer, this may get shut down. The powers that be may turn off my internet.
Well, I mean, one thing that I would say, like all of us have been working on moving towards a social safety net and a system that really supports families and trusts that families know best what they need to support themselves and their kids. And I think, a few years ago, this was sort of an outrageous notion that we could actually create a system where people just get the money that they need unconditionally to support themselves and their kids. And then we had a global pandemic, and the federal government sent out checks to families, and we expanded the child tax credit and saw child poverty decrease by 30%. And we know it's possible. We know it can be done. And I think that it's sort of the onus is on all of us to keep on pushing, to keep on sort of lifting up like what we know about programs like TANF, what we found in doing this research, that it is a system that is excessively punitive, that harms Black families, that sanctions Black families at higher rates, and withholds child support that non-custodial parents pay to support their children. I did notice a question in the chat around the actual, I'm trying to recall what it was exactly, but around the amount of money the average family is missing out in terms of child support dollars. And although we don't know that by family, we do know that last year alone, the state of Illinois collected over $40 million in child support, and only passed through to the family a little over $2 million. So that is a huge amount of money that extremely poor families are not receiving because they're enrolled in TANF and subject to these harsh sanction policies and like a really racist structure of a like so-called safety net program that's supposed to benefit the poorest children in our state and their families. So maybe I'll stop there. And I'm sure I did not answer your question, but
you did it in the most beautiful way. I just love it. But yeah, I think you covered it, and just understanding that the implications of what happened after public benefits in the 60s and 70s became available to Black mothers, and this country's decision to our politicians' idea to create what they, the welfare queen, and the implications of that live on today. We see the direct impacts of that within our families. We talk about the criminal legal system. We talk about the needs in certain communities. But as Kim stated, I don't know how often and how many times we have to study and do pilot programs to show that when you give poor people money, they have better life outcomes. It's shocking every time we see, like, people are just flabbergasted when you give and trust poor people, their life outcomes are for their children, for themselves, exceed any expectation that we could think that we have. And so I'll stop there because again, I don't want to get on my soapbox. And that I think oftentimes people will say to us as we are lobbying around this, that yeah, we know that this is we know that this is a good thing, but it costs money. We have to decide what matters to us. I think politicians and our leaders have to decide, because it's easy to give tax breaks to those at the top, but to give people their own money, their children their own money, oftentimes we shouldn't have to have these fights. We shouldn't. Let's see, is there any? Oh, absolutely not. That they absolutely don't, because again, it's the who deserves and who doesn't. So when you get access to a benefit, it's like amazing. But if, the person who lives in, we're a non-political organization, but if thinking about Chicago as a, adjective that folks are using now today, is I can have this outside of the city of Chicago, but they shouldn't have that in Chicago. They shouldn't have access to this. And when you say Chicago, there's an absolute meaning to it. Do we have, and the chat going up, thank you all. I'm very excited for what's going on in the chat. I know we have another question, I'm sorry, that I missed. Can you speak to the kind of legal support a parent needs to prove the good cause exemption to the child support requirement? And that question is coming from ACES. Shout out to ACES, who used to be at Heartland and definitely was in Springfield with Kim and I. We love you, ACES. We hope that you're doing well at AFC AIDS Foundation Chicago. So that's another barrier for families. And thank you for asking that question, Kim, again, or Suniya or Maxica, if you want to step in. But having to prove that you're a survivor of domestic violence, having to prove that you are experiencing homelessness, having to prove that you have a disability, it's not as easy as just saying it, because we don't just believe people. We have this presumption that poor people lie. Like that's just it, that they can't be trusted. And so it's, you know, finding someone who we have deemed within white supremacy, someone who is the voice of reason. So having a service provider signing something, saying that you've gone to court and got an order of protection, and giving that to your case manager. If you're experiencing homelessness, having a shelter sign a letter for you saying that you're experiencing homelessness. It's not you're just taking on your word. It's that you need assistance from legal aid or from case management in your community in order for you to be able to jump through that hoop. It's not as easy as just saying that you are able to, that yes, I'm having this lived experience and you should trust me that I'm having this lived experience. Any other questions? If not, what I'll do is, I just really appreciate the, oh, go ahead, Suniya.
No, I was gonna say, I know we have questions about when the report will be released. We're hoping to release it tomorrow. And like Naya said earlier, you'll get a link to that as well as the executive summary.
Absolutely. And share it far and wide. And we will be sending out action alerts. And I hope that y'all are okay with it, because we're hoping to get this bill out of the Senate, as we said. And so we have to push on our officials to say that this is important and this needs to be a priority. And as we're closing up, I just want to say, I am so grateful for all of the people who are here today, especially the people that are on this panel, Suniya, Maxica, Kim. Thank you all so much for being here today. Thank you for your work. This project started with a conversation between our organizations in 2019. Our funder, the Robert Woods Foundation, thank you so much for funding this amazing work. To take something that, you know, oftentimes when we're thinking about research, we think about wonky people sitting in a room crunching numbers. Taking something and making it digestible for me. When I tell you, I sat in the room once with them as they were doing some of the coding, and my brain shut off. I just said, oh, I'm not doing this. I can't do this. But Maxica, Miss Leanna, Miss Edrika, Miss Newman, all were just sitting there, and they're like, okay, we're taking this and we're bringing this over here and we're gonna put that over there. And I just became a turtle in the room. They have done the work, the interviews, taking quantitative and qualitative information and making it into something that we can all read and understand, whether this is our first time learning about TANF or it's something that we've been doing or you were fighting against in 1996. You all, I can't express my thanks to you all enough. And I'm so excited to be able to take your work and take it down to Springfield and be able to, and take it to, you know, Washington, DC, and say, these are the changes that need to be made because these folks are saying it's not enough. So thank you all for your work. And thank you to our comms department for really setting this up and making sure that we were able for you all to be able to see us today and hear us and be able to comment in the chat. We really appreciate it. Anyone else before? And thank you all. Thanks to viewers like you for joining us today. We really appreciate it. And like I said, Suniya said the report will be out tomorrow. You all will get a copy of the report, the executive summary, as well as this recording. We appreciate we appreciate viewers like you. I think that's it. Everyone take care and have a great day.